Hi, my name is Dr Jessica Djalikian. I'm one of the chiropractors here at Sims and Finn Chiropractic in Dandenong. In this video, I will be explaining to you what the popping, cracking sound you may hear in your spine comes from. The crunching sound that you hear has nothing to do with your bones cracking or rubbing against each other. The sound comes from tiny gas bubbles within the fluid that lubricates your joints. When the joint opens up rapidly, it creates a cavity within the fluid, causing a popping sound. Popping, twisting, or cracking your own neck affects your spine in various ways. Cracking your spine by yourself is referred to as self-manipulation, which is very different to experiencing a chiropractic adjustment by a chiropractor. Self-manipulating does have several risks that you need to be made aware of. Firstly, you need to know, does your neck have any disc bulges? Are there degeneration or structural changes through your cervical spine? Some of these risk factors make the spine vulnerable to twisting forces in the neck. Many of these problems can be identified and planned for with the proper exam, but without one you may be unaware of the quality of your spinal structure. Secondly, how is your spine aligned at the moment? Do you know which direction puts it into a better position? Are you manipulating the correct vertebrae? Are you pushing the vertebrae into a worse position than it already is? Lastly, constant self-manipulation causes loose ligaments, which then causes poor stability. As you manipulate your spine, you are causing ligaments in the spine to stretch. When you stretch a rubber band enough times, it eventually loses its shape and becomes less stable. Your spinal ligaments work the same way. When people have ligament instability, it leads them to depend on manipulation to keep feeling good. The problem with this is that they feel the need to manipulate their neck more and more, which is not ideal. What can you do to stop popping your own neck? Find a chiropractor. It is important to choose a chiropractor who measures what they are doing to the spine. At Sims and Finn Chiropractic, we focus on neurostructural correction to help guide the spine to a more normal state. It is important to seek the opinion and assessment of a qualified practitioner. It is very important that the correct vertebrae is the one that is adjusted. During self-manipulation, the neck vertebrae that is not moving correctly is the one that needs the attention. Though when you self-manipulate, the vertebrae above or below that joint is the one that makes the popping sound, as you are unable to pinpoint with accuracy which neck vertebrae needs to be adjusted. It is important that the correct location and angles are applied to the vertebrae to make a positive correction. While self-manipulation can cause a temporary feel-good sensation, it can also create unnecessary hypermobility, which is too much joint movement, and long-term structural problems in the neck. If you know anyone who self-manipulates their spine, please do them a favour and pass this information on. Chiropractic can address the reason that the person feels the need to crack their own spine. After all, you cannot get a spine transplant. The one you are born with needs to last your whole life. And if you have any further questions regarding spinal self-manipulation or any other spinal related questions, please make an appointment online at our website or call our friendly staff on 9792 1945.